So little changes can make a big difference even for someone who's suffered for a very long time. You have some people who are flying around the country, enrolling in different clinical trials, trying experimental drugs. And I think that energy and effort would a lot of times be better spent using some of the strategies that we recommend.
I'd like to introduce another tinnitus expert. This is Dr. Lori Zitelli, audiologist at the University of Pittsburgh, where she works clinically, specializing in tinnitus, and teaches courses to students focusing on tinnitus. We're going to jump in first, asking her about some common beginner mistakes. So, Lori, what are some common errors or mistakes that your patients make when they walk into the hospital looking for help for their tinnitus?
One big mistake that I see a lot is people going to the wrong kind of provider for their first help-seeking appointment. So sometimes people will end up going to a provider who's more of a general practitioner. And in a lot of instances, I think that's okay. But when you have something like tinnitus, where you really need specialized care, so starting with an audiologist who specializes in tinnitus care is a really great way to go. And then they can make referrals if they're needed based on any of the other symptoms you're presenting with.
So what you're suggesting is someone who goes to their primary doctor or gets referred to their local ENT doctor, that might be sort of a roadblock. What are some common experiences you hear from your patients?
A lot of people are told that they just need to learn to live with their tinnitus, or that there's nothing that anyone can do for them. And we know that there are a lot of things that we can suggest for people to manage their tinnitus more effectively. And we also know, based on recent research that's been related, that satisfaction is higher when people see audiologists first.
I hear sometimes from patients in our community, they might not like the word manage. Talk to us about that. What's possible with tinnitus in terms of reduction or treatment or management, and maybe some of the nuances around the language we use.
I think that's a really interesting point, because manage kind of implies that it's not something that's going to be cured. And cure can be kind of a dirty word when it comes to tinnitus, because everybody has tinnitus, even if it doesn't particularly bother you. It's really not a reasonable expectation to expect that you'll never hear your tinnitus. Cure is really not a word that we use. It's more about managing the impact of tinnitus on a person's life, which is why I tend to use that word.
How would you define a successful treatment? How does someone know that their tinnitus is a lot better and that they should accept their improvement and not necessarily need more because that's a successful treatment for tinnitus?
I think there are a lot of different ways that you could measure success. One thing to think about is the number of activities in your life that are impacted by your tinnitus. So, for example, these could be things like sleep, your relationships, your hearing ability, your ability to focus and concentrate on things like that. So you could think about all the changes that you're experiencing over time in the improvements in those symptoms and those problems. Another way to measure success is to think about, when you're working with a provider, validated questionnaires. So these are things that your provider is going to ask you about how your tinnitus is impacting you. And it's the same set of questions every time. And that allows them to compare your answers at one time point to a previous time point and see if there's a change.
Yeah, I love that. And we often use the Tinnitus Functional Index, which is one of these evidence-based tools to measure tinnitus. Dr. Jastreboff, I also studied with him as well, and he mentioned that stage 4 of habituation, which is ultimately the desired goal for most of our patients. Remember, habituation does not mean you're just getting used to it and you're trying to forget it because I'm mind over matter, right? No, that's wrong, right? Habituation refers to this natural brain process where when we set up things just right and we don't have any roadblocks along the way, the brain has a natural ability to reduce the awareness and oftentimes the volume of tinnitus over time through different stages, from stage 1, where it's the most intense, causing troubles with sleep, focus, anxiety, etc. Eventually, through a treatment program, getting to stage 4 habituation, where, through the definition here that I learned, the awareness of tinnitus is less than 20% of waking hours.
Yeah, I think awareness of tinnitus is a good one. Level of botheredness of tinnitus or annoyance of tinnitus is another one. You can think about, so even if I'm noticing my tinnitus, if it's not particularly bothersome to me, or if it's not preventing me from doing things, if I have to think about the total amount of time in a day that I'm bothered by my tinnitus, and it's a fairly low number, I think that would be a measurement of success as well.
I want to switch gears slightly and talk about patients who have chronic tinnitus for many years, because at Treble Health, a lot of patients come to us and they might say things like, hey, I know that tinnitus has gotten better for these people I've seen, but I've had tinnitus for 7 years, and I haven't personally met someone who's reduced tinnitus, even though they've had it pretty bad for many years. Uh, do some case studies come to mind where even you perhaps were blown away at the power of neuroplasticity and how tinnitus can improve? I've had numerous of these cases where each time I go, wow, just when I thought I knew the power of the brain to reduce tinnitus, I'm consistently, impressed.
Absolutely. A lot of people who have tinnitus struggle with it for a long time. And it's always interesting to talk to patients who come in and say things like that, because a lot of times they'll tell me they've tried many things over the years. We do know that there are new products, new strategies, new technologies being available that we're incorporating into our treatment plans. And I think that's really important. But it is really interesting to see how even changing something slightly or adding a new component to your treatment plan can make a huge difference to someone who's even struggled for years and years and years. So we know that tinnitus treatment is really a multi-pronged thing. So you can never just try one thing. So little changes can make a big difference even for someone who's suffered for a very long time.
And have you seen the volume level of tinnitus decrease for someone who, say, had tinnitus pretty severely for over 5 years? Have you seen cases where after treatment, even in that case, the volume has come down?
Absolutely. So really, it's interesting because there's your perception of the tinnitus, which is how it sounds to you, and then your reaction to your tinnitus, which is how bothered you are by it. And those two things are not necessarily linked. So you can have people who are bothered by their tinnitus that's not perceived to be super loud. You can also have people who are bothered by tinnitus that's perceived to be very loud. So a lot of times whenever people reach that stage of habituation where the tinnitus is not as bothersome to them, a component of that is that the tinnitus reduces in volume or becomes less noticeable for them. So it's definitely possible, even for people who struggled for years and years.
How have things evolved in the past years from your eyes in terms of the kinds of information that patients are learning?
I think we're seeing a lot more self-care options, which I think is really nice for people just because it gives you more opportunities to try different things kind of easier. It doesn't involve another healthcare provider necessarily. And a lot of times they're kind of no cost or low cost options that you can incorporate into your management strategies. So things like stress reduction, using exercises like deep breathing and guided imagery and things like that, things like improving your sleep hygiene. There's a big link between tinnitus and sleep disturbance. Using hearing protection appropriately, using sound enrichment in your environment. These are all things that people can do at low to no cost to them that are generally not big effort items. And then, of course, telemedicine. It's a great way to improve access for people, and you guys are doing that probably better than anyone.
I remember the first time I saw one of my patients come back to me for a follow-up after they'd implemented a guided breathing exercise program, which really the goal was to settle their mind and settle their body. How have your patients incorporated guided breathing, whether that's mindfulness exercises or meditation or something else?
So some of my patients use apps that can guide them through specific exercises or just remind them to do certain things at certain times or under certain circumstances. Some of my patients are a little bit more purposeful about it, and they really try when they notice themselves getting particularly agitated or bothered by their tinnitus. They really try to step away, take a minute, go through their exercises. And a lot of them do really say, think in the moment, whenever you're, as you mentioned, your brain is on high alert and you're feeling stressed and on edge in the moment, those things do really help to bring you back down to a kind of a baseline level where you can then start to kind of regroup and gather yourself and cope a lot better. So I love breathing exercises. I think it's a great strategy. I'm a huge proponent of CBT. If you look at what the evidence says about tinnitus, cognitive behavioral therapy is one of the most highly supported strategies to manage tinnitus. And there are a lot of ways to do things like that. So you could work with a provider. There are online programs that are kind of self-guided that you can work through yourself on your own time at your own pace. And then there are kind of hybrid options where you work online with someone in a telemedicine format. All of the strategies that you learn in CBT are going to be helpful for you if you have some sort of a chronic condition. And tinnitus is a great example of something like that.
I'd love to hear some stories of some of your patients who have used CBT. I want to share a quick one about someone who I met years ago in California who was the host of the San Diego Tinnitus Support Group put on by the ATA, American Tinnitus Association. And he shared that he had loud obtrusive tinnitus for about 5 years in one ear. And he started working with a therapist who helped him change the language he was using and basically reframe the experiences. And instead of saying, tinnitus is killing me today, to use different language. For example, tinnitus I'm hearing is very loud today, but I'm strong and I will be able to get through this. Instead of saying, I can't deal with this anymore, to instead say, any normal person would struggle with this, but I'm doing pretty well considering how far I've come. And these can be just inside his own head. No one else even needs to know. These can be how he responds to these automatic thoughts, just with a more neutral, perhaps positive, optimistic outlook. And he swore that this kind of switch really helped him turn the corner. And he would say things like, yeah, I still hear it, but I'm not bothered by it. And that comment can really frustrate people who have not gotten there yet, because it almost doesn't make sense. How can you still hear the same sound, but it doesn't bother you? If you're hearing the sound, it has to bother you. That's what people think. So curious your take on this, and then we can jump to some other exercises you might have too.
Yeah, absolutely. So the thing that comes to mind is I have a patient who used to struggle most with his tinnitus when he would wake up first thing in the morning. And he had this reaction to it. If it was a good day or a bad day, the reaction would be very different. So he'd wake up on a bad day, and before we started working together, his initial thought was, oh my God, my tinnitus is so loud today. It's going to be at one of those bad days. And that's just, it's not very motivating. It's what they call a cognitive distortion. It's a thought that's not productive. It's not helpful. So using strategies that he learned in CBT, he was able to identify thoughts like that. And then just like you said, use language that's different. So rather than waking up and thinking, oh my God, my tinnitus is so loud today, it's going to be terrible, he now can wake up and say, oh my God, my tinnitus is so loud today. It'll probably get a little bit less noticeable once I get up and get a shower and put some music on and start drinking my coffee and kind of start my day. So that small shift in thinking is enough to, motivate him to get up and get going. And it makes a big difference in his day.
Quick aside, coffee, good or bad in your opinion for tinnitus?
A lot of people will say that they do notice a difference in their intake levels of caffeine, alcohol, salt, things like that. Other people say it makes no difference at all. So I would say it's a reasonable thing to keep an eye on and look at. And if you notice changes in your tinnitus, it's worth mentioning and discussing with your provider. Maybe some, modifications can be made in your behaviors. But if it's something that you feel like doesn't impact your tinnitus at all, I say enjoy that cup of coffee.
Yeah, totally agree. I think it's worth experimenting on an individual level, but the research I've reviewed for a population of people who have tinnitus doesn't suggest coffee or caffeine is bad. Therefore, keep using it, and it's definitely not going to set you back and make some sort of permanent change. All right, let's go back. So what are some other self-guided exercises or things that you've seen work with some of your patients that you wanted to bring in?
Well, can we talk for a minute about sleep? So things like paying very close attention to your sleep hygiene. I know these are the kinds of things that nobody wants to do because it's like telling you not to look at your phone and all of that stuff that we all do, even though we know it's bad. But it really does make a difference in your sleep habits and your ability to get restful sleep. So a lot of times when people have trouble sleeping, it's falling asleep or staying asleep. And there are really a lot of things that you can do to try to make that better, more restful for you, and kind of a consistently better experience. So these are going to be things like, try to avoid napping during the day, go to bed at the same time every night, make a consistent routine so that your body kind of recognizes it and knows when you're ready to go to bed.
One tool there that I love and makes so much sense in my personal life as well as with patients is that if I'm ruminating on my thoughts, if I really didn't do that well to prepare myself for sleep and I'm having a hard time falling asleep, if it's been more than 20 minutes and I'm still rolling around in bed or haven't fell asleep, stand up, leave my bedroom, walk to a different room, sit in a chair, and sit there until I'm tired again. And I don't need to do anything in that other room. I could have sound therapy on it because we don't want to just torture ourselves by being in a quiet room with loud tinnitus. So you're certainly welcome to use sound therapy, but sit in a chair until you're tired. And we're training ourselves that the bed is for sleep, not for struggling to fall asleep. And even though it's so simple and pretty intuitive, it actually works.
Absolutely. Laying there staring at the ceiling is one of the worst things. It's just kind of torturous. So I completely agree with you. Get up, if you're not asleep in the first 20, 30 minutes or whatever, and only go to bed if you're tired again, as many times as you need to throughout the night.
Hey guys, quick interruption from today's podcast. If you're dealing with the day-to-day stress of tinnitus and have been told there's not much you can do from other doctors, I want to let you know that we offer a free consultation with a specialist from Treble Health where we can discuss your tinnitus case and offer some potential solutions. See the link on the screen right there where you can book a free call and get help from a specialist who can take the next steps in finding relief. Click the link right there. Now, back to the podcast. Well, we hope everyone listening has good sleep tonight. If this has been helpful so far, comment below here on YouTube, helpful. And now we're going to switch gears slightly to root causes of tinnitus, an important subject, one that most doctors don't understand the nuances of. So, Dr. Zitelli, what have you found in terms of the diagnostics here, the testing, various medical exams, and how that can lead to a diagnosis of the root cause of tinnitus?
Most people who have tinnitus have what they call primary tinnitus. So that means it's not related to some underlying other medical issue that needs medical or surgical management. So there are a bunch of other health conditions that may impact tinnitus or exacerbate tinnitus. So we can talk about that a little bit if you want. But for most people who have tinnitus, it's something related to the signal that's being transmitted from the ear to the brain. Dentists actually are a huge ally for us. So we know that there's a link between TMJ or temporomandibular joint disorders, things like clenching your teeth, grinding your teeth. There's definitely a link there to show that tinnitus can be exacerbated or made worse whenever people have these issues. And the better part of this is that when you seek treatment for those kinds of things, generally your tinnitus gets better. So it's worth doing because more than half of people who have those issues get better when they work with a dentist to treat them. I have a patient who has struggled with tinnitus and TMJ issues for a very long time. And she called me in a panic one day because she was noticing this new onset of tinnitus, and she was kind of saying she had gotten used to her old tinnitus and she got this new tinnitus now, and she really wasn't sure what she could do to manage it. And then we talked a little bit, and I learned that she recently got a new bite guard and she didn't feel like it fit as well as her old one. So we sent her back to her dentist. And then a couple weeks later, I heard from her that she got her new bite guard. It fit great, and her tinnitus went back to its baseline. So they're definitely related.
Yeah, and in my experience, TMJ related to tinnitus. So this falls under the category of somatic or somatosensory tinnitus, which is one of the subtypes. Doesn't apply to a majority of cases in my experience, but a significant percentage. And what I usually see is that this type of tinnitus can have fluctuations more than other types of tinnitus. So some days are really quiet, some days are really loud. Movement of the jaw, head, or neck can significantly change their tinnitus. These people sometimes have tinnitus just on one ear or one side. The tone or the quality of the sound can vary. So yeah, each subtype has its own characteristics. Somatosensory tinnitus, we often refer to it as the least understood amongst the population and amongst doctors. Any other tips for folks who might be wondering, could my tinnitus be related to somatic or somatosensory?
Yeah. So there was an article released semi-recently that showed kind of a simple screening procedure for this. And it was asking, essentially there's a flow chart and you go through it and it asks you, do you have like tension or dysfunction in your jaw, neck, shoulders, upper back area? And do you notice that your tinnitus is worse whenever that dysfunction tension seems to be worse? And if those two things go together, and if you're doing, certain movements and you notice that your tinnitus increases, it's likely that you may have somatic tinnitus. So people who are likely to have that often seek care from dentists. And another big one that we see is physical therapists. So there are cervicospinal physical therapists who can really do some good work in this area that can help to alleviate tinnitus as well.
I love that. I've also had some success with doctors of osteopathy who can do an evaluation of the neck, because what we need is a diagnosis that there is an abnormality in the neck, right? If someone has a history of neck issues or injuries, well, that's a sign to investigate it. If someone has bad posture, that's another sign to investigate it. But sometimes when there's symptoms that suggest potential somatosensory tinnitus, we may send the patient for an evaluation, right? And then based on those results that are not done by an audiologist, but done by another, trusted colleague, then we can get a clearer picture of, might this disorder that was found be related to tinnitus? Like we had mentioned earlier, if treating the disorder of the neck or the jaw, if that's available, then one should most likely pursue it, because that could be the sort of the misunderstood piece of their tinnitus, or the opportunity that no other doctor has tried to fix. There's a problem that, generally speaking, a lot of doctors make the mistake of saying the tinnitus, implying that it's all the same. In reality, it's not. It's not. It's almost like saying, the stomach pain. It's like, well, what's causing the stomach pain? I remember being trained in wilderness first responder. We feel into different quadrants of the stomach because there's different organs going on there, and something wrong in one area is not the same type of issue as something else. So, getting down to the root cause as much as possible is important. However, with tinnitus, we're not able to do that 100% of cases, right? There's some cases where we still have treatments available, even if we don't have high specificity on what the cause was. What are your thoughts on that for patients who maybe are too fixated on the why and not putting enough energy into the what can I do about it?
I think that's a huge barrier to success, to be honest. If I were to think about one of the things that is the root cause of someone not improving, I would put that near my list. Someone who's fixated on a medical cure and is not willing to put in the work that they need to do to manage it. So, you have some people who are flying around the country, enrolling in different clinical trials, trying experimental drugs. And I think part of that is just this hope that there's going to be something somewhere that finally gets rid of their tinnitus. And I think that energy and effort would a lot of times be better spent using some of the strategies that we recommend day to day in our consultations.
What else are some reasons which cause challenge for people to get better? Some struggles or some roadblocks that maybe are preventable, or we can do something different.
I think sometimes people take their management plan that's been, that they created with their audiologist, and then they try to pick and choose the items that they either want to do or the ones that they think are important, without realizing that really the whole thing is important. We talked about this a little bit earlier, trying to ignore things like anxiety or depression, or saying like, I don't want to wear devices on my ears, or I don't want to use sound therapy, or, things like that. So really picking and choosing treatments, I think, is a barrier to success as well. And then also unrealistic expectations. I think that's a barrier. Sometimes you have to talk to people a little bit to find out what's changed over time. And I think moving the goalpost is a common thing that people do too. So at the beginning of treatment, someone might say, I would be so happy if my tinnitus was 30% softer. And then, a year, 6 months, a year down the road, they may feel like their tinnitus is a lot softer or less noticeable, but then they've moved the goalpost and now they want it to be even more soft or even less noticeable. So that's, again, just one of those reasons why kind of checking in with people at regular intervals and talking about expectations is important.
How quickly do you typically see results?
I would say most people that I work with see an improvement within the first 6 months for sure, many within the first 3, and some sooner than that. So, you have some people where you fit them with devices, and while they're sitting in front of you in the clinic, they say their tinnitus is significantly less noticeable. It does take some time for some people to undo some of those connections that have been, really forming in their brain over all those years. And sometimes it just takes a little bit longer. But I would say most people within the first couple of months notice significant changes.
Certainly, I agree. I think that's a very important point to understand, that the treatment of tinnitus is a marathon, not a sprint. It takes a lot of conditioning and repetition for the brain to really filter out tinnitus and push it into the background. It's a common experience that patients say, which is, tinnitus was in the foreground of my mind. I was thinking about it nearly all the time. During and certainly by the end of the treatment, the tinnitus is way in the background. It's often softer for a lot of folks, but even the ones who the volume doesn't necessarily change, you talk to them and they say, I don't hear it much. It doesn't bother me much. I'm a lot better. Yeah, it's still there. And again, I want to highlight that point of, we're trying to describe what habituation feels like. But if you've ever heard one of the podcasts here on this channel with a graduate, or if you've met with someone who's gotten better from tinnitus, you can see it in their face. You can really hear it in their voice about the impact that it's made on them, despite tinnitus not going away.
Mhm. And that's one of the things I really like about working with people who have tinnitus is it's a long-term relationship and you can see people change and it's very rewarding.
Long term, but hopefully not too long, right?
No, but a lot of people who have tinnitus do have hearing loss, and then it becomes a long-term relationship, for that reason. Even if the focus shifts, it does tend to be a long-term relationship.
I want to bring it back to you to talk about your patients, important daily observations you have as a tinnitus specialist. As we're entering the last few moments here of the podcast, just want to stress the importance of seeing a specialist as a tinnitus specialist. What are you seeing in today's tinnitus patient? What do they need to know?
I think some of the most important things to think about are consistent use of sound in your environment, because a lot of times people will say that their tinnitus is the most noticeable when they're in a quiet environment. So using sound in whatever form you want, delivered to your ears in whatever form you want, meaning you can use headphones, speakers, whatever you want to do, some kind of sound in the background. I think that is one of the most important things that we can tell people to do throughout their day that's going to make their tinnitus less noticeable. And I think people who want to manage their tinnitus that's super bothersome just need to be open to this multi-pronged treatment approach that we've talked about. So be open to all the things that your audiologist is recommending and don't check anything off the list prematurely.
I love that. Dr. Lori Zitelli, thank you for joining us from the University of Pittsburgh. Where can patients find you or learn more about what you do?
I am not on a lot of social media, actually. You can find me on the UPMC Find a Doctor website, and I believe I have a PIT page as well.
Thank you so much. Talk soon and hope to have you back on another episode of the podcast.
Thanks so much.
All right. Hey guys, I hope you enjoyed today's podcast. I loved talking about the tinnitus care Dr. Lori provides. If you'd like to work with a specialist on our team at Treble Health and get some questions answered about your specific case, click the link on the screen right there where you can book a free call. In this discovery call, you'll learn the next steps needed to find help. And whether that's with our team in our program or another referral to a specialist, we're going to take this next step very seriously for you. So click the link right there and we'll see you at the call.